Hi, my name is Ahmed Al Baghdadi. I'm the Pharmacy OSCE Instructor here at Prep Pharma, and today we'll be reviewing one of the sample station videos about an OSCE case. We will be assessing the performance of the student as well as providing feedback and some tips on how to manage the station with the different aspects. So we'll get started right away.
Hi, how are you?
I'm good. How are you?
Good, thank you. I took my blood pressure for today
Mm-hmm.
and it's 150 over 110. Is this normal or not?
Thank you so much for your question today. How can I address you?
I'm Julia.
Hi, Julia. My name is Ahmed. I'm the pharmacist on duty today. To discuss your question better, we will discuss this in our private counseling area, okay?
Okay.
So first of all, the patient or the doctor or the another healthcare professional or the patient's agent would come into the pharmacy and have a question or inquiry in mind, which is the opening statement. We will welcome the patient, identify either the doctor, the patient, or the client by their name, and I would introduce myself or the pharmacist, and then we will reflect on their opening statement to verify for understanding, and we make sure we can address that fully. So just wanted to ask, how old are you?
I'm 45 years old.
45.
Yeah.
And do you have any allergies?
No, I don't.
No allergies, all right. And did you just check the blood pressure today as one time?
Yeah, one time for
One
today.
time. Okay. And do you check it usually, like in general?
Yeah. In general, it's 125
Mm-hmm.
over 75.
As I did here, we would jump right into assessing the main concern, which the patient had an elevated reading of 150 over 110. So we would ask all the necessary questions around it first before jumping into the template or the info gathering process and then follow through the case. Do you go to the doctor's
No, at
office?
pharmacy.
At the pharmacy usually here. Okay, that's good. So if you don't mind me asking, I just need to ask a few questions about your medical history as it may be related to your blood pressure. Do you have any medical conditions?
No, I don't have anything.
Okay, and do you take any prescription medications?
No.
No, okay. And I see that from your profile, you're 45 years old and with no drug allergies, right?
No.
Okay, I see. And do you consume any over-the-counter medication?
I'm consuming Tylenol or Advil
Mm-hmm.
as needed for headache.
Okay. And is that just as needed or like you take them?
As
Okay,
needed.
I see. And anything else in terms of over-the-counter medications? Okay. How about supplements like calcium, magnesium, or herbal products?
I don't have.
So what we did here, we proceeded with the information gathering process, starting with asking for any allergies. The patient did not have any medical conditions, the types of prescription medications they are on, if they are taking any, and any over-the-counter products, which could be sometimes missed by the student not to ask for these, and they could actually affect your recommendation. So we would ask for all of these, and also including any supplements, vitamins, or herbal products. So besides the medical history, Julia, sometimes your lifestyle may affect the blood pressure as well. Do you mind if I ask you a few questions about your lifestyle?
Sure.
So it's always a good practice to ask permission for gathering information, especially in sensitive areas. For example, if you ask the patient if they were a female patient, if they were pregnant or were breastfeeding, because sometimes the recommendation or the type of products you will recommend may affect their conditions, right? So it's always good practice to have that rapport with the patient and then ask the questions beforehand. All right. So basically, do you drink any alcoholic beverages?
No, I don't.
Okay. Do you smoke?
Actually, yeah, I'm smoking.
You smoke? Okay.
Half a pack in a day.
I see.
And before I came here, I take my cigarette and my coffee.
Oh, I see.
Yeah.
Just how long ago?
Half an hour?
Half an hour ago. I see. Okay. So have you ever considered smoking as it may affect your blood pressure in
Sometimes.
general? Sometimes? Okay. And whenever you're feeling ready to quit, just please don't hesitate to come to us and discuss this further. We can recommend many different products for you.
Okay.
All right. So this is a good part just to quickly mention to the patient, even though it's not the main discussion of the case, which is smoking cessation. You can just bring it up to show the patient that you care for them and it's part of health promotion, which is one of the competencies covered in the PEBC that we will have to address. So do you have time to exercise?
I'm working from home,
Mm-hmm.
so my time is a little bit light, so I don't have time to do workout.
Oh, I'm sorry
Yeah.
to hear that. Yeah, I know it could be tough with you working from home, develop this kind of sedentary lifestyle,
Yeah.
but we will try to accommodate this. I'll give you a few tips about that as well to help with your blood pressure. And how about your diet, Julia?
My diet actually is not that good.
Mm-hmm.
I'm consuming fast food, sugary things,
Mm-hmm.
3 cups of coffee.
Oh, I see. Thank you so much for answering all of my questions, Julia. If you don't mind me checking my reference, just to give you the best answer, and I'll get back to you, okay?
Okay.
Thank you. It's always good to practice to follow a template, whatever that you have ready. Even if you don't have time to write down some notes, it's good to have it in your mind just to bring it up quickly, starting like welcoming the patient, establishing rapport with the patient, identifying yourself and the patient in question, and then proceeding to ask for consent, establishing the confidentiality in the private area, then moving on into info gathering. So what helped us with the info gathering is that we identified the patient is a smoker, and the patient usually drinks caffeinated beverages. Usually, the customers would give away answers when we ask open-ended questions like, "Do you smoke or do you drink caffeinated beverage?" We could tell them how many you smoke, or how many cigarettes you smoke, or how many cups of coffee do you drink a day. For this example, the patient, without even us asking, she mentioned she did smoke a cigarette just before coming to the pharmacy to check her blood pressure, as well as she had a cup of coffee. So will affect your recommendation in the end, as you will see. So what I'm doing right now, I'm checking the reference. I ask permission from the customer to check the reference so they would not be confused on what I'm doing at the moment. So based on my reference, this was a one-time elevated reading of 150 over 110. But again, for a confirmed diagnosis of high blood pressure, or we call it hypertension, it needs. So here I identified the term hypertension because we have to use a simple language to the listener. If it was a doctor or a healthcare professional, we can just proceed with giving the medical term. But since it's a patient, we would give them an explanation. And then, for example, if we said hypertension, we will have to explain that to them, or just keep it at the simpler term, which is high blood pressure. At least 2 to 3 office visits of multiple readings of a blood pressure, and the optimal blood pressure would be something around 120 or less over 80 or less, right? Since you don't have any other medical conditions like diabetes. Yeah. So my recommendation in this case was based on Hypertension Canada guidelines. This is not diagnostic of high blood pressure. This is one-time elevated reading, and the fact the patient did smoke a cigarette and had a cup of coffee before coming to check the blood pressure did affect their elevated blood pressure. In general, blood pressure readings in the pharmacy or office-based blood pressure is usually 125 over 75, which is normal for the general population, and the fact that the patient does not have any other medical conditions. So this is based on this, we would say, office-based blood pressure reading of being more 140 over 90. I will proceed with giving my recommendation as you will see in the video, and this will explain more of the recommendation. There are also other techniques which are recommended to check the blood pressure appropriately. And the ones that you did, which you smoked, and you had a cup of coffee half an hour before coming to the pharmacy, it could affect your blood pressure reading, and that's why it could be elevated, right? So, based on my reference, the recommended techniques would be just not to consume anything of these for at least half an hour to an hour, to relax for at least 5 minutes before doing your blood pressure checks. Having multiple readings or an average of that will help as well. Basically, you would come and just sit straight with your back against the chair and your feet flat on the floor, and basically just lay your non-dominant arm on the table like that, and just basically use the required cup size to check your blood pressure, and then you just do it relaxed, no talking and being quiet to have the accurate blood pressure reading. So we explained to the patient the proper technique of checking the blood pressure, and that is starting with resting for at least 5 minutes before doing the blood pressure checks, and before that making sure they have not consumed any nicotine or caffeine before coming and checking their blood pressure, right? based on the reference, the patient had an office-based blood pressure reading of more than 140/90, and this calls for further investigation. The fact the patient had one-time elevated reading of 150/110, we would go and investigate further by checking for an out-of-office blood pressure readings, either through ambulatory blood pressure monitoring, which is preferred, and this is provided either through the family doctor or the cardiologist. And these will be the readings that would determine after if the patient had a blood pressure or not. Or the more convenient way and more available way, they can purchase a blood pressure machine, or they can use their blood pressure machine at home and check their blood pressure and bring it back either to the pharmacy or more preferably to the family doctor. And this will be, of course, diagnostic of a blood pressure if it was over 135/85. But this is again based on multiple readings, taking an average of these readings and then verifying, as you said, preferably with the family doctor or the cardiologist to diagnose for high blood pressure. Also work on some of the lifestyle factors that could actually affect your blood pressure, such as your diet. We could improve that in terms of eating better, like consuming more vegetables, fruits, and less sugary and oily stuff. Trying to cut down on the salt go a long way, actually. All right.
Okay.
I know you're working from home. It could be tough to adapt a more active lifestyle, but if you could exercise for at least 3 to 4 times per week, that could go a long way to help with your blood pressure, especially to reduce. All right. Of course, cutting down on caffeinated beverages and considering to quit smoking, that also has a major
Try
part.
to do my best.
Yeah.
Yeah.
All right. That sounds great. Is there any other questions that you have
That's
for me?
great.
Yeah, what I wanted also to mention, if this is repeated high blood pressure readings, we could always check back with your doctor to have an office blood pressure checking. Okay?
Okay.
All right. Thank you so much for coming today.
Thank you for your time. Thank you.
Okay, so the last part of this case was about following up and giving feedback to the patient and assess for their understanding of the recommendation. So what we explained was following up on the lifestyle measures, and we tailored the lifestyle one step at a time, whatever can be accommodated to that specific patient without overdoing it. For example, we would understand that they are working from home. It's not always easy for them to go and exercise. So it's always good to focus on the diet in this example, maybe consuming a Mediterranean type of diet or what we call a DASH diet, which is dietary approach to reduce high blood pressure. So this is a better recommendation than just mainly focusing on the exercising, which is also kind of recommended. But for the sake of this patient, we would focus on other approaches that we can actually change. Also, we offered again the smoking cessation part, and we advise them if they have any questions, if they have any products in mind that they would like to try, they can always talk to us. So we will always keep this door open to them to give us a call or either visit us at the pharmacy. And the last part, we would follow up with the doctor or the patient if this got repeated, regardless of their proper blood pressure checks, regardless of them adjusting their lifestyle as well. If this gets repeated and it's actually elevated, then we would advise them to go and see their family doctor to have a proper blood pressure check, either in the office and out of office as well. This was the explanation and the feedback for this specific case. I hope that you had a better idea of how OSCE cases would be run, starting, of course, with welcoming the patient again, addressing the main concern, identifying yourself as a pharmacist and the patient in question, of course, establishing privacy and obtaining consent if needed. Also, proceeding with focusing on the main concern, first of all, and then proceeding to the info gathering process with having the template in mind, moving on to checking the reference and providing the recommendation in a very clear and concise way so the patient or the healthcare professional would understand. And then in the end, we would provide a follow-up to ensure understanding and if they have any further questions. Thank you so much for joining us today. My name is Ahmed Al Baghdadi. I'm the Pharmacy OSCE Instructor here at Prep Pharma. Thank you.